Hi, I'm Lauru Kane from the Plastic Surgery Office of Dr. Dean Kane in Baltimore, Maryland. I want to talk about ThermiVa. ThermiVa is a procedure that's used for vaginal rejuvenation. The reason why I'd like to talk about it from a personal level is because we researched it out for me actually personally. We chose to consider Thermi, which is a radio frequency machine that actually not only deals with feminine rejuvenation, but it's the same procedure that also can be used to tighten and firm up neck and skin. So it was kind of a perfect dual situation. But I was really personally interested in what it could do for vaginal rejuvenation. I hit menopause, and like all women who might, not all women, but maybe some women who experience and get into menopause, we experience some vaginal drying, loss of sexual sensitivity, looseness, and I wanted to see for myself whether this could actually improve that problem for myself. So Dean and I, Dr. Kane and I, went to Washington, D.C., and I personally had the procedure before we decided to purchase the machine. He came with me, a nurse at this office did the procedure, he was in the room with me. I was very surprised to find that it was a very comfortable procedure. It's a thin probe that goes inside the vagina wall as well as externally. It was extremely just a warm, I felt like it was like a warm massage. And I was really impressed that it had very little discomfort with it. And on the other side, we were really shocked to see how it actually gave instant results. Like instant results. Like I was so pleased by looking in the mirror and seeing that the internal labia had actually shrunken and shortened, and it just gave a more beautiful appearance, and I was really happy with that. And then what's nice is you are able to, sexually, you can have sexual relations actually the next day. And again, the results I was pretty surprised with, that it actually improved what I was hoping for. I was hoping for greater sensitivity, greater tightness, a more pleasing. Really pleased with the external appearance of my vagina, where the labia had beautifully shortened, and also was really excited the fact that the internal walls of the vagina had now been tightened as well. The reason why I think this is such a great procedure, because it really covers for women from childbirth to menopause. So when you have different issues like vaginal looseness, vaginal dryness, the skin laxity and incontinence and sexual dysfunction, believe it or not, this non-surgical procedure actually helps improve all of these issues. ThermiVa uses radio frequency, which is a warm energy, and it uses a probe. Our nurse is the person who does the procedure for you. And it's a probe in which the energy goes through the probe. The probe is used both inside the vagina as well as externally on the labias. So you're getting tightening and shrinking of the external labias as well as you're getting tightening of the internal walls of the vagina. So what you get out of ThermiVa is multiple positive things. One is that you get the tightening. The labias, the small labia shrinks and shortens. What women don't like is, the extended labia. So you're getting that tightening and internal shortening of the labia on the outside. It increases sexual enhancement. For women, it can help with discomfort during sexual activity. So those women who are really experiencing some pain during intercourse, it can improve that. It helps with lubrication, as well as if you have some mild to moderate incontinence, it can help that. It also increases sexual sensitivity and really enhances your sexual function and enjoyment. And so I really do think it's an amazing machine that is a non-surgical approach. You can have 1 to 3 treatments. It is recommended to have 3 that are done 1 month apart. But I have to say, after 1 treatment, you will experience very positive effects. Each treatment that you have thereafter just reinforces and enhances the situations. It really depends on your personal issues and how severe or mild they are. So we could guide you there in terms of whether you would need 1 or 3 treatments. And it's really a great procedure. We do recommend, or we do advise that we need to have you be seen by your gynecologist. So if you haven't had a recent checkup, that we do require your GYN to give us clearance in order to make sure you're a good candidate for this procedure. All right, so if you really would like to learn more about the ThermiVa procedure, I am more than happy to talk about my own personal experience with it and help you determine if this is the right procedure for you. So give us a call, 410-602-3322, and of course a lot of information is on our website, drdeankane.com. All right, I'm here to talk about it.